Hello, my name is Louise and I'm a trainer with Healthy Cornwall. The purpose of this video is to help raise awareness about mental health. That is, what is mental health, how to recognise at what point it's useful to ask for support for our own mental health and well-being, as well as look at a few things we can do to look after our own mental health and well-being. When we refer to mental health, we tend to think of poor mental health. But the World Health Organization offered this definition of mental health. So a state of well-being in which every individual realises his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her own community. So it's more than just about the absence of disease. It's about how we think, how we feel, and our sense of well-being at any one time. Now, it's also important to acknowledge that we're all individuals, so those normal stresses of life are different for all of us. What's normal for one person is different for somebody else, okay? Because we are all individuals and we're all different. Now, we're going to be talking about mental health and well-being, not mental ill health. We all have mental health and we all have physical health. One can affect the other. So for example, if we think about if we've got a really bad cold or the flu, there are physical symptoms, aches, pains, runny nose, sore throat. However, there are also thoughts that we have when we're ill. We feel fed up, we can't be bothered to engage, we feel tired. Okay, so that is our mental health that's having an impact. There's a connection between physical and mental health. However, stigma stops us from talking about mental health. Now, when we think about mental health, we all exist on a continuum. And there's 4 broad categories of people in any workplace. So I'm going to show you a slide with a mental health continuum on it. Now, when we look at this continuum, okay, there are 4 broad categories. All sorts of things can lead our mental health to dip down the continuum, and if not tackled, can lead to physical illness as well as anxiety and depression. We all fit on the continuum. There's 2 extremes, okay? Maximum mental well-being all the way down to minimum mental well-being. Think of it as a scale, and stigma runs through it all. Okay, so that vertical line represents our societal line, and most of us travel up and down it every day. It's normal. We all exist in one of these 2 quadrants, a person with positive mental health and no mental illness, or a person with poor mental health but no diagnosed mental illness. It's normal to move up and down those 2 quadrants throughout the day. It's life. It's natural to move down to quadrant 2. It's okay to feel sad. That is not mental ill health. However, issues arise when we get stuck in the 2nd quadrant, maybe for a period of 2 weeks or more. We may not notice when we get stuck there. For example, a low mood that stays for weeks, or when we don't take any action when we realise there is an issue. If we get stuck for a long time in quadrant 2, we may move to quadrant 3 and towards possible diagnosis. And that takes us to our horizontal line, which represents our medical line, for example, our GP or other health practitioner. And when we go and speak to someone, we may get a diagnosis, and that label can open doors to treatment, or for some, it may be a barrier to accepting help or accepting a diagnosis due to stigma. And stigma runs throughout our continuum. Prejudice comes from stigma, and discrimination from prejudice. Now, when we're in quadrant 3 and we accept our diagnosis and we accept treatment, it takes us up to quadrant 4. That is a journey. It takes time. There's no instant solutions, but recovery is possible. So when we reach quadrant 4, we still have our diagnosis, but we return to positive mental health. And depending on what that diagnosis is, it may be possible to return to quadrant 1. So whereby that diagnosis is no longer relevant, so we don't have one, and we have positive mental health. Now, the exact cause of most mental illness is not known, but it's thought to be a combination of physical, psychological and environmental factors that play a role. And mental health problems can affect any of us at any time, but may be overcome with treatment. Now, within the workplace, we tend to talk about stress and pressure, and we use those two words simultaneously, but actually they're quite different. Pressure in the workplace is perfectly normal. A certain amount of pressure in our daily lives actually can be really good for us, can keep us engaged, keep us interested, keep us excited, and allow us to perform to our peak performance levels. Not enough pressure can lead us to feeling bored and fed up. So it's really good, a certain amount of pressure. However, issues come when there's too much pressure. Too much pressure can result in stress. And stress, if we do nothing about it, can result in burnout. And it's really important that we recognise when we're experiencing stress. So it's really important that we look after our own mental health and well-being, that we recognise when we move down into that quadrant 2, and especially if we get stuck down in that quadrant 2. Okay, if we don't look after our own mental health and well-being, it's going to make it really difficult for us to support others, whether that be colleagues, family or friends. So self-care, looking after ourselves, is really, really important. And I'm going to put up a couple of activities that you can do to help look after your own mental health and well-being. Okay, it can be good to think about things that are causing you stress and how you can manage these. Now, we all have a stress container, okay? And the size of our stress containers will dictate how much of life's pressures we can take before we reach our peak performance levels. Every container will be a different size. It will depend on our genetics, our values, our beliefs, our childhood and life experiences. Now, life stresses flow into the container. So, for example, I want you to imagine Jane. Now, it's near Christmas and Jane's husband has said he's invited all the family around. Now, Jane comes from a very small family. She's an only child, just her and mum and dad. She doesn't have any cousins, so quite a quiet childhood she's had. Our husband, he comes from a big family. He's got 5 brothers and sisters. He's got his mum and dad. He's got cousins and aunts galore. And he says to Jane, without very much notice, "Oh, I've invited them all round for Christmas." Now, Jane's thoughts is that she may start to worry about that. She may start to worry about where are they all going to sit. So that thing that's causing her stress, that worry, is going to go into her stress container. How on earth are we going to pay for it? Where's the money coming from to feed everybody? How will we know when they're going to leave? They might stay all day and all evening. Maybe some of them will want to stay all night. Who on earth is going to do all the cooking? Who's going to do all that washing up? Will she get a chance to sit down and speak to her own parents during Christmas? What about all the different diets of people? There's some vegans, there's some vegetarians, there's some pescatarians. How's she going to manage that? Okay, so pretty soon her stress bucket is full. She's reached what's called her stress signature. And when we reach our stress signature, we often become uncomfortable with the feelings associated with that. And we call this experiential avoidance. And when we go into experiential avoidance, we tend to resort to unhelpful coping strategies, such as smoking, drinking, avoidance, isolation, burying our heads in the sands, procrastination, rumination and other distorted thought patterns. And those things, rather than helping these unhelpful behaviours, they seize up what could be a tap on our bucket to get them out of it. Okay, so rather than emptying our bucket, it's just causing more stress to go into our bucket and it overflows. Now, if we resorted to more helpful coping strategies, such as physical activity, healthy diet, setting times aside for ourselves, talking, switching off from distractions, accepting what we can't change, all these things allow a tap on our bucket to open and the stress to flow out. So, in this scenario, if she spoke to her husband, how many people exactly have you invited to come? Are you going to be helping with the cooking? Perhaps they could ask their visitors to bring something along to share for the meal, rather than them having to provide all the food and do all the cooking. Maybe she could prepare a to-do list and assign tasks, delegate. Maybe actually letting their visitors know that there's a finish and a start time for their visit. So there's an expected time that they need to leave. And pretty soon, our stress container is starting to empty. Okay? So it's not going to overflow. And we're not going to feel overwhelmed. So as our stress bucket starts to fill, if we resort to helpful coping strategies, it will keep it a bit empty. Now, I've left a couple of bags in the bucket because there's always going to be something in our bucket or our container. There's always going to be something that we cannot control, that's out with our control. That's just part of life, and we shouldn't worry about those things. Okay, so that's our stress container. And if you access the slide on this video, or there is a link to the YouTube video that we've prepared through Healthy Cornwall for the stress container, it talks you through it. Okay, so have a look at that, and maybe that's something that may help you if you find yourself down in that quadrant too, or maybe if you've got a colleague or a family member or a friend that you could help, maybe that might help them as well. Okay, another thing we can do is practice the 5 ways to well-being, sometimes known as Connect 5. And again, I will put a link on this video to the YouTube video that we've created for this if you want a bit more information around it. So evidence shows that small improvements in well-being can help to decrease some mental ill health and also help people to flourish. So these 5 ways, the first one is staying connected. There's strong evidence that feeling close to and valued by other people is a fundamental human need which contributes to functioning well in the world. And social relationships are critical for promoting well-being and for acting as a buffer against mental ill health, or when we find ourselves floating down into that quadrant 2 and maybe getting stuck there. Being physically active is really good for us. Regular physical activity can be linked with lower rates of depression and anxiety. And exercise is essential for slowing age-related decline and promoting well-being. So when we're physically active, whether it's just going for a walk or doing some gardening, doing something physical, it releases positive endorphins in our brain, those feel-good hormones, and it's really good for our well-being. Taking notice. Studies have found that being aware of the present directly enhances your well-being. So savouring the moment in any given time can help to reaffirm your life priorities. Heightened awareness also enhances self-understanding and allows you to make positive choices based on your own values. So enjoying and taking notice of the things around us. Keep learning. When we're learning, it continues to enhance our self-esteem and encourages social interaction and a more active life. When we learn something new, we feel a sense of achievement. And evidence suggests that the opportunity to engage in work or education particularly helps older people to lift out of depression. So the practice of setting goals has been strongly associated with higher levels of well-being and makes us feel good about ourselves, have a sense of achievement. And the last one is giving. Well, people who report taking pleasure in helping others are more likely to rate themselves as happy. When we make someone else feel good, we feel good. And research also shows that committing an act of kindness once a week is associated with an increase in well-being. Now that might just be giving a little bit of our time, stopping and listening to someone, going doing someone's shopping, just something small, doesn't have to be anything big, but actually makes us feel good about ourselves, which promotes our mental health and well-being. So when we look after our own mental health and well-being, it actually helps us to support others who may be having some issues with their mental health or find themselves stuck down in that quadrant too. And when we do, there are things we can do to support them. We can encourage them to talk. And when we do, we should listen and try not to worry about saying the wrong thing. Ask what you can do to help them. Be patient. Allow silence, as this can be very supportive, and it gives the person the opportunity to think about what you've asked them. Try not to label or stereotype, because as we know, labelling or stereotyping can create stigma, which can inhibit individuals seeking help or support. And offer support rather than solutions, because when we offer solutions, we might be thinking of things that have worked for us in the past. But remember, we're all individuals, so what worked for us may not work for them. But instead, be supportive and retain realistic expectations about your role. And most importantly, just give hope and be positive to the person. Help them feel good about themselves and offer praise where necessary. At the end of this video, I have laid a page called Useful Resources, and on it, whether it's for ourselves or for a colleague or family or friend or someone we're working with, some of these may be useful. So NHS Cornwall, I've got a mental health support line at the minute. It's free, it's available 24/7, and the phone number is there. The Samaritans have also got a really useful self-help app just now that anyone can go onto. It's free and has got some of the suggestions I've spoken about during this video, as well as lots of other things that individuals may want to do to help promote their own mental health and well-being. If you go onto the Healthy Cornwall webpage, and I've put the link there on the last page, there are lots of useful suggestions about staying healthy, particularly during this COVID pandemic, which may help with mental health and well-being. And I've also put the YouTube links for the stress container and the Connect 5 if you want to see the videos that we've put together to explain what they are and how you can go about using them. Otherwise, if you go to the Healthy Cornwall webpage and you're interested in any further training with us, we do have a variety of training workshops that we're delivering just now digitally. We have a bite-sized trio of workshops. There's a combined one, stress and resilience. There's also mindfulness, meditation and sleep hygiene, and they're free. All you have to do is go onto the Healthy Cornwall website and you can sign up for them. We also are delivering mental health first aid just now through a digital offer. There is a 2-day mental health first aid course which is spread across 4 days. Normally when it's face-to-face it's 2 days. However, if you're interested in that, there is a small cost involved for that one. But the key thing is any of our training workshops is go and visit our webpage and see if there's anything that might be of interest to you and that you might find helpful. So thank you for watching this video, and I hope it's helped to raise your awareness, even just a little bit, about what mental health is, and recognise that we all have mental health. And also that at what point it's useful for us to ask for support in order to manage our own self-care, our own mental health and well-being. And I also hope that the couple of suggestions for things that we can do to look after our own mental health you find useful, whether for yourself or to help a colleague, a family member or a friend. And as I say, please do look on our website for some useful advice and support there. And best wishes.